بسم الله الرحمن الرحيم، الصلاة والسلام على أشرف الأنبياء والمرسلين. السلام عليكم ورحمة الله وبركاته. Welcome to 2030 Leaders Mic. ومعانا اليوم الدكتورة ميسة السباعي. نتشرف اليوم إننا نسمع Who is Maisa?
Thank you so much. I'm humbled by being in a room full of exceptional people. Everyone has a unique story and everyone has something to say. So hopefully today you'll listen to my story.
Looking forward to it.
Inshallah. I'm an idealist. I'm a perfectionist. I'm motivated by the word no. You can't do it. And I grew up in a family of pioneers. My grandfather was one of the earliest writers and educators in Mecca. And from there, my whole family is either in academics or in education. And it's all about getting degrees and studying and being the best that you can. I'm married to a wonderful man. He was my classmate, Dr. Al-Badawi.
MashaAllah.
And together we have three amazing children. I have Farah, she's 15, Yusuf is 17, and Abdurrahman is, I'm not going to say his age because then you'll calculate mine. He's a mechanical engineer and he's doing a master's in robotics.
MashaAllah.
I've always wanted to be a first because of the situation with my family. I've always wanted to be a pioneer in anything. I didn't know what, but things happened later in life and I was. So, alhamdulillah. Finally, I'm an oral and maxillofacial surgeon. That's جراحة وجه وفكين. So originally I'm a dentist and I specialized in that. And I work at King Abdulaziz University in academics and as a clinician. And I'm currently chairing the department.
MashaAllah. So before we get into the leadership and your journey, you also have some really creative hobbies.
I never had enough time to commit to developing a hobby into something that's, I'm still an amateur in many of these, but I like biking, hiking, anything that has adrenaline. I like driving. I'm going to learn drifting.
Nice.
And I like anything that's fast and dangerous.
Wow, my kind of gal. No, but I must say something. Yani, Maisa was with me in the track. I have seen how she deals with certain situations فعلا with her creativity. يعني كانت at the end of مثلا a module, she came and represented a complete design with everybody's name on it, and it was very creative. And this was her just dabbling كده في أوقات الفراغ. You do really have this, mashallah, ملكة الcreativity يعني والartistic touch.
I do like to draw, and I'm interested in calligraphy. So whenever we're in a meeting or I'm actually listening, I'm really engaged. I'll always draw the name of the person next to me, sitting next to me. It's kind of like a way of connecting. And what I did was I drew the whole cohort in a certain way. And I put all their names, and that was the very first week we met, and that was my way of connecting to all of them.
Yeah, that was amazing. طيب, Maisa, tell us what shaped you as a leader.
Okay, so my leadership journey started very early. I was maybe 5 or 6 years old, and let me put some context to the situation. We were living in both my mom and dad were on scholarships from the government, and so I grew up in the States. And we were in this little town in Michigan. And back then, and I'm not going to say the date because then you'll also calculate my age. Back then, in the 70s, it wasn't a very diverse population. And being, I don't know how many in the room are Gen X. Being Gen X, we spent most of our time from after school until night outdoors. So there was the playground. And this playground had a mix of different kids from different backgrounds, but not very diverse. And I took a look at the dynamics in the playground, and I really didn't like what was going on. They were the playground is like a small representative of a community, and there were the bullies and the pushovers and the quiet kids and the shy kids and the motivated kids, and then there are the unmotivated kids that are just waiting to be instructed, and then there was this chaos going on, people pushing people off the swing, and I didn't like what was going on. I wanted to blend in, but yet I wanted to be unique because I knew I was unique. So the first thing I did was I changed my name. So my playground name was Lisa.
Oh.
Okay, because that in my mind broke down the first barrier. The first barrier was, Maisa, what is that? Who are you? Where do you come from? So I broke that down, and then I started organizing the dynamics in the playground. Okay, you had enough you get off. The bullies, okay, you're not allowed here background. So the people who lived around that playground were only allowed, okay? This is our community. And I started organizing things. And there was this little boy, Ali. He was bullied every single day. I went and I stood up for him. And I made sure that everybody respected Ali. I became the queen of the playground.
Then take us through your professional journey.
I graduated from high school here in Jeddah. I lived between the States, Riyadh and Jeddah. I eventually graduated from Jeddah and entered dental school. I wasn't really connecting with any of the subjects, and I really had this interest in a specialty that was very new and very difficult, surgery. So I went to one of my professors and I said, what is that? How do you do that? And he said, oh, no, don't even think about that. That is very difficult. That's only for boys, only for men. You can't do it. So just, go take some cooking lessons, because now you're about to graduate and you need to think about getting married. So that was a big, huge motivator for me to say, okay, well, I want this even more. Let me explore. And because we had limited resources, I had to rely on the opinions of the mentors and the professors around me, and everybody said the same thing. You're not going to make it. And so I went to this professor we had in the university. He's from the US, and I said to him, this is what I want to do. And he said, your chances of surviving in that specialty are like the chances of a snowball surviving in hell.
Wow.
And that shook me, but at the same time even added more to my determination that I wanted to pursue this specialty. There was no other woman in Saudi Arabia that had specialized in this. So I graduated, I was given a full scholarship from the government, no difference between male, female. I was given the full scholarship. I married my classmate. We packed our bags and went to Boston. I was Arab, I was a woman, and I was pregnant. And,
oh, wow.
Yeah, and for us, the childbearing years are the same years that are your career years. So I wanted it all. I didn't want to stop one thing for another. Alhamdulillah, I had support from my family, especially my husband, and he just kept pushing me and kept sacrificing with me. So we pushed through, and I got degree after degree.
MashaAllah.
I did my residency, I did a master's of science, I did a doctorate, and then I got my American board, which was a very difficult exam, but alhamdulillah, and I achieved that first. I was the first woman in Saudi Arabia to achieve that American board in this specialty. Of course, during my residency, it was not easy. Gender bias, discrimination. I had to work 4 or 5 times more just to prove myself. But I persevered, alhamdulillah. Allah gave me strength, and I have a passion for it, in addition to the support from my husband and family. I returned to Saudi Arabia full of hopes and dreams, and I got my degrees. I'm going to be the best surgeon, I'm going to teach at the dental school, and I'm going to do everything. And I continued to have kids. I had 2 in the States, and then I had the 3rd one here. And I multitasked, I was very resourceful, tried to make it all work, And I was shocked at the amount of acceptance. I was accepted, very well received by the university, by my colleagues. However, it was the community that dealing with a woman surgeon and dealing with the trust. There was no trust. And so I had to deal with comments like, you're a woman, you're not doing my surgery, you're weak. I had a man refuse his son's surgery because in the holding area, before we went into the operating room, he said to me, you're not doing his surgery, you're a woman. And I said, well, I'm trained, I'm qualified. He would not even listen to me. And then he asked me, who's that next to you? I said, that's my resident, that's the person I'm training. He said, is he going in with you? I said, yes. He said, okay, I'll allow you to do the surgery if he's going in with you. He looks like a very good surgeon. That's the person I'm training. So at first it got to me. They would look me in the eye and they would say, you probably have kids and you're probably not very, you're busy with them, so you're not very up to date. The only reason I got the appointment with you is because the other guy was booked. Comments like that. So I was either going to be the victim, I'm going to be a victim. I'm going to be a creator, and I'm going to be patient, and I'm going to change people, and I'm going to be a part of that change. One patient at a time, one family at a time, one case at a time. And Allah subhanahu wa ta'ala gave me the strength to just be patient. I know where you're coming from, just try to prove yourself. But it took a toll on me because you're constantly under observation. Fast forward a few years, I kept chugging along and things started to change. And I saw the change, and I'm happy to be part of that change in Saudi Arabia, empowering women and empowering individuals.
Very true. Alhamdulillah, فين كنا وفين صرنا. But I have a question here. You don't think, maturity level also plays a role in how much we are affected or not by what people actually think and what their comments are?
That's true. I mean,
يعني في مرحلة كده اللي هو يعني.
That's true.
Say what you want to say.
That is true.
Because I'm there.
As years go by and you have more and more experiences and more stories, it's like I've seen it all.
Yeah.
The comments don't bother me. Okay, they used to brush me maybe in a different in a very bad way or in a negative way.
Yeah.
Right now, I don't really care. I'm just going to move on and be the best that I can be and just do my job and try to make those even little subtle changes by influencing others, maybe other women in the specialty, students. All that contributes to the big paradigm shift that we're seeing. MashaAllah.
So now you are teaching في الجامعة and you have your private clinic?
Right now I teach at the university. I have a practice at the university and a private practice.
MashaAllah.
And I chair the department. So some administrative work as well.
MashaAllah. So do you find yourself in the administrative work, Yani?
A few years back, I got the opportunity to chair the department. It was offered to me. And the reason why I accepted that position was I've seen so many women who are highly qualified and highly and brilliant and capable. I've seen them being passed up for leadership positions. And they've been asked to be vice so-and-so or deputy so-and-so or member of the committee, but always the bridesmaid but never the bride.
Yeah.
I've seen that happen so much, so I wanted to, when it was offered to me, I didn't want to pass up the chance, and I thought, okay, well, here's another challenge. And like I said, I thrive on challenges and adversity and tough times, so I went ahead and accepted, and then this is my 6th year as chairman.
MashaAllah.
Yeah.
So I think there's also another part of your journey that wasn't tapped on, which is the crisis management. In your domain, you're dealing with a lot of crisis.
In surgery, you have to be very calm, very collected, very relaxed. Surgery is quite repetitive. You know, you learn the technique, you master it, you repeat it, and then you teach it to someone else. But there's a very steep learning curve. It's not easy to master. But then once you master, even if you are very capable, things happen, and they can happen in a split second, and you have to react. But you can't freak out, and you can't lose it, and you have to be always calm and collected and composed. And that we got used to it, because part of our training was also military style. Hierarchy and orders and no negotiation. So being in that situation, I've learned how to manage myself in crisis and kind of like be calm and break it down. So what I consider a milestone in my journey, in my professional journey, came one day when I was about to go home, and I was just a person at the right place and the right time, and something really bad happened. Somebody was going to die, and they called me because I was the person that was passing by, and I managed the situation, alhamdulillah, and the patient did not have a negative outcome. But it was at the expense of me realizing that there was a flaw in the system. And I had a mixture of anger and sadness. So I went home and I wrote down everything that happened on that day, the whole event, and I wrote down how we could have prevented that. Okay, and then I wrote a protocol for future prevention, and where we had this near miss situation, and how we could have been proactive by having a certain protocol in the system. So I put that on my boss's desk the next morning, and a few days later I got a letter on my desk again saying that I've been appointed to head a newly established department and managing or dealing with these kind of situations. And they gave me a small room, one nurse, and a landline, and a clean slate. And they just said, do what you need to do.
Nice.
And I already had the vision, and I knew what I wanted to do. I knew exactly what I needed to do. And I'm very hands-on, so it didn't matter that I didn't have like a whole team of people. I could have just sat there. I had the authority. I was head of department. I could have just sat there and just started giving orders to people. I didn't do that. I gathered the people around me, and I said, we're a task force. Okay, give me ideas. Let's start brainstorming. I wrote things down. I started taking pictures. I think over the next 5-6 years, I built it. In addition to training modules to train the students, the faculty, the assistants, everybody in the institution, how to deal with these situations. And I built this very, very concise, well-structured module that we were actually commended on when accreditation bodies came to accredit us. And I would do mock drills every few months, where I'd actually bring an actor, and they would act. Nobody knows that this is an actor. They would act the situation, and we'd see like all the students and the assistants and everybody what their reaction is. And I always watch that program, Undercover Boss. So I got this idea of, okay, well, how can I watch this scenario unfold without actually being there, so I can write concise reports. So that's what I did. I went undercover, start documenting, time, response time, deficiencies, gaps, people's reactions. And the idea was not to pinpoint or blame anyone. The idea was to identify those deficiencies so that we have a really tight-knit system. So.
Yeah, but that's also leadership. So, yani, you've shown your leadership, whether it's in the crisis mode, or whether it's in the training and development mode, even in the guidelines or regulations. So you have many layers of, mashallah, what you are doing. Now, to add to that, and there's another part that I know that you're starting the entrepreneurial part of you is starting to rise.
Yes.
Tell us about it.
Really, the Misk program helped shape that. And I'm grateful for the program and the people that I met in the program. And I remember the very first lunch we had at Misk, and I sat with a group of people in finance. And we don't know each other. This is like only a few hours, and then they were there talking about crypto and VC, and I got lost, and I started looking around for that table with the doctors. I said, okay, I'm really intimidated here. I don't know what they're talking about. And I'm plotting how I'm going to do this transition from this table to the doctor's table. And then it hit me. And I said, absolutely not. I am going to sit here and I'm going to listen to them, and I am going to ask questions. And I am going to say, okay, what's this? What's that? How do you do this? How do you do that? Teach me.
Nice.
And I made that conscious decision, and I don't regret it, of course. I've learned so much. I'm working on actually a training center for dentists related to my area, related to emergencies, related to protocols. And I am hoping to work with the MOH and accreditation bodies to mandate this, just like the basic life support is mandated as a certificate. So I have a proposal ready for that, and inshallah, hoping to launch it soon.
You're looking for partners, right?
Inshallah, yes. If somebody's interested, of course, yes. We'd like to push this. We'd
like to push this with entrepreneurial mindset. يعني there's an opportunity here يعني في التخصص نفسه, which is the beautiful. Inshallah, for sure. وإن شاء الله يعني within this opportunity, people are going to hear about it, leaders are going to hear about it, وإن شاء الله يعني you'll be approached with whoever's interested. طيب, you've mentioned a lot of stuff صراحة Maisa. So يعني tell us, what would the to-go-to service to Maisa?
Well, definitely if you need your wisdom teeth out.
Yeah.
Okay. So if you need your durus al-aql, you need implants.
Does that include crowns and stuff like that?
No. Just the surgical part.
Okay.
Yes. But on another level, other than the domain expertise, I've gone through so much. I've become adept at realizing problems or crises before they happen and actually managing them when they happen. So I think that stems from my training. If you definitely have a problem, maybe I can help you with that.
MashaAllah, tabarakallah. يعطيك العافية. طيب, I'm going to open the floor to the questions. تفضلي.
Thank you so much. It was really quite interesting. My question to you is, number one is, I just need to know, how did you manage a medical degree and children? I mean, one person can't do that, or two person can't do that, and you're in the States, so that's the one. The second question would be, I've been hearing lately, a lot of us went through gender discrimination and survived it and persevered, and it actually helped us build resilience. But I've been hearing lately that a lot of our generation as well is having these consensus around age discrimination. Does it resonate with you? Do you think that's right? What is your thoughts about it?
I've gone through having kids, pursuing a career in a very strenuous residency, and I've kind of become, I don't want to say an expert, but have a lot to say in terms of the recipe. Now, like I said before, the childbearing years for us is the same years that you want to build your career. And I wanted it all, and I didn't want to wait. I didn't want to wait to build my career, and I didn't want to wait to have children and have a family. And I wanted to have a family where I was younger. So you need to be resourceful. You need to be very resilient. You need to have a support system. That's the most important thing around you. And you just need to find creative ways to make it work. It's not easy. It's so easy to lecture someone about it and time management, this and that, and it's in the real world, it's not as simple as that. But can it be done? Yes, it can be. It needs a lot of willpower, a lot of organization, a lot of thoughts, and a lot of just take it day by day. You know, I've been so creative in ways to manage my clinic time with my kids, with their homework, with family issues, and with work issues. I remember one day I went to the clinic and we have a doctor's lounge, and I had my son with me. He was 6 or 7 and he had an exam, and I had an emergency case. It wasn't my clinic day, but I had an emergency case, so I had to go see him. So I thought, okay, well, he's got an exam and I need to sit with him. So this is just an example of how creative I got. So I took him with me to the clinic. I put him in the doctor's lounge, and then there was a doctor just sitting there, you know, doing nothing. And I said, what are you doing? And he said, well, I'm just sitting. I said, well, okay, you know what? He's got page 10 and 11. Read it with him and make sure he does the homework. I'm going to go see a patient who's bleeding. Okay. And I came back and he said, okay, done. So you just got to juggle things. And that's the ultimate juggling act. I've gotten so accustomed to it that I don't know any other life. You know, I'd like to add that my mother married my dad at, she was 15, and she had a sixth grade education. She was in 6th grade. And my dad was a college graduate. But through the years, she continued her high school, college, master's, and she got a PhD and was a faculty at the university. All meanwhile having 4 of us. So I grew up seeing this lady who was working, studying, and having kids. And for me, it was just the only way I know. Maybe I'll have a training center for women who, because it applies to any woman who's working and who wants to have a family.
Well, I fairly to say, on behalf of the fathers, there's the assumption that some fathers adjusted their seating, so I'll be delicate with this. No, but honestly, a lot of men, there's this assumption that men don't play a role with raising kids, which is not the case, right?
No.
So some of them are not capable to juggle as well. And, you know, it's focused, khalas, it's work, home, and the home does not mean having to do anything with the kids, especially when they're young. Actually, what I want to say is this coaching part is not only for women. I mean, it could be also for both genders. That's because true. As she's a mother, he's a father,
yes.
and it's,
got
you know, the balance act.
A huge
the balance
role
act,
in the support system.
Exactly.
And about Allah subhanahu wa ta'ala, if it wasn't for my husband, who was extremely, extremely understanding and picked up where I left off, I couldn't have done it without him.
Amazing. So, khalas, dahan we just shifted the training center from a purely female training center to a
yes.
Amazing.
And
amazing.
then the second part is the age. Now, I personally have not experienced this. In different disciplines, there are different ways of looking at age. In my specialty, I think age is synonymous with experience. And being that surgery, or in general medicine, dentistry, are all about the more you do, the more you're capable of. I think, alhamdulillah, age has not been a factor because, like I said, it's synonymous with experience. But I don't know that maybe in the next 10 years things will change, but...
No, actually, I hear your question, and I know where you're coming from, because I'm seeing a lot of this. فعلا.
Hearing a lot of this sentiment, and it's just, I find it, I mean, I haven't witnessed it, but the sentiment has been repeatedly انه خلصنا من الجندر discrimination الحين دخلنا في الage discrimination.
But I will say something. يعني, for instance, the 3 of us, we've heard of it. We've heard of people in this situation, but we have not faced it. So I want to add something here, which is some people want to live their age بزيادة عن اللزوم, and they focus on that part, and they focus on that يعني يعيشوا الجو ده. therefore they're dealt with بهذا الشكل. Age should not have anything to do with into your output, your capabilities, and your creativity. And there's assumption that's with age خلاص يوقف creativity. I think as long as that's ongoing, you're not sensing it.
And also keeping updated.
And keeping updated.
Especially like, for example, with technology.
صح.
Now you talked about the process that Thursday made you think, and the department you established. Are you doing that in teaching in the university? Are you teaching your students something about that situation?
Yes. That's the module that I created. After that happened, I realized that part of the reason why all of that happened was that we weren't teaching the students. So I started from the base, and the base is obviously the student. So right now it's a well-established training module that is mandatory every single year. At the time of an emergency or something that, a crisis, sometimes you get a block and you can't think. So protocols were written so that you just go through the protocol without having to process anything in your brain.
I remember seeing, it was a movie where a surgeon who had cancer, and he had to go to the treatment center in the same big hospital he was working in. And the first thing he did after he survived the experience and everything, and he did through the therapy and everything, that he took the first batch of students that came to training, and he put them all in gowns, put them in beds, and he asked the nurse to treat them as a patient for a week. And that's what he did, what he wanted to give them a feeling that he discovered when he started treating, is that what does a patient feel?
Yes.
Do you think something like this also can help the students?
Yes, definitely. And we do teach them at the university a whole course on communication and empathy. I think it's very theoretical and not enough. And I think what you said is absolutely right. They need to be placed in a situation where they are the patient. It's a brilliant idea, and I'm going to take it to the people that are handling the course.
Yeah.
Much for your inspirational interview. Surprisingly, while you were actually telling the story about the emergency that happened in front of you, the ambulance actually was passing
really?
away.
Yeah.
So there was a background, mashallah, of كذا edit, natural editing حصل. You mentioned the story about the guy who didn't trust you to operate his
Yes.
son or whatsoever. Have you ever faced the opposite story of that, where actually no, they wanted you to do the operation instead of someone else? Or
I've gained that trust from a lot of patients, and I have patients, both genders, male, female, come to me and say, I want you to do the surgery. And then I would say, well, I don't have time, or I need to refer you to my colleague, or I don't. They would insist. Now, I do have a category of patients who prefer a woman surgeon. Yes, the past few years, alhamdulillah, I've achieved that, and that's the reward of being patient and persistent.
Salute you for your very extensive and very inspiring story. It's really very hard work you have done, especially in the environment when there is bullies and discrimination against women. I really just want to salute you
Thank
for
you.
your achievements.
Yes.
Thank you.
Thank you very much.
يعطيك العافية.
you
Thank
very
you.
much.
حقيقي فعلا totally you deserve نيشان بس على ال perseverance.
Actually, my husband
he
disagrees with
هو
you.
يستحق كمان نيشان
He is the one who says he deserves it.
والله you both do. You both do. Any other questions?
Thank you so much.
يعطيك العافية
Thank you.
دكتورة ميسة. It was amazing. Very inspiring. وشكرا لكم جميعا على الحضور. يعطيكم العافية.